The University of California at San Francisco has a really good children's hospital, which is called the Benioff Children's Hospital. When Isabel was 7 years old, she was invited by UCSF Children's Hospital to come to that facility for treatment. Isabel had been born with a rare genetic disease called MPS 6. It means basically that her body's lacking an enzyme that it needs for all sorts of things, and that causes severe damage to her body and her cells in a way that's not going to get better on its own and not going to get better over time. UCSF wanted to launch an important clinical trial to try to develop a treatment for that rare genetic disease, but they needed her in their trial to be able to do it. Rare is an important word in this story, right? For her rare disease. By definition, for any rare disease, there just aren't that many people who have it. There aren't that many patients. The way you get new cures for rare diseases is to find the patients who have those diseases and get them involved in testing potential cures. You need to be able to find patients to be able to develop the cures, to be able to beat those diseases. That's how it works. So Isabel, who had this rare disease, she and her family were invited to come to San Francisco, to come to UCSF for this experimental treatment. Because they were able to do that, the clinical trial was able to go ahead. And ultimately, the treatment that Isabel received in that trial, it got FDA approval as a way to manage this disease and to keep patients who have this disease alive. That FDA approval basically would not have happened had Isabel not been able to come to UCSF to take part in that crucial trial. Well, today she continues to be treated at UCSF. She gets weekly intravenous infusions. Remember, again, she came in for the first time when she was 7 years old. Because of her illness, her family was told that she might never make it to see age 8. Isabel is now 24 years old. She's a summa cum laude college graduate. She was director of the student government organization at her college. She started a scholarship fund for students with disabilities. She says she now may want to go to grad school. She teaches dance to other kids who are also patients at the children's hospital that saved her life. She still needs treatment. Again, she needs weekly intravenous infusions of this treatment. She also needs additional surgery. She also has a tracheotomy, which is a delicate thing and needs consistent and expert care. But she is alive, well past what would have been her life expectancy. She is alive, and that is a contingent thing. Her doctors say if she stops treatment, she will die. And not on some distant horizon, but in a matter of months. The Trump administration has just sent Isabel and her family a letter ordering them to get out of the United States in 33 days, or she and her family will be forced out by deportation. For Isabel, this is very simply a death sentence. I mean, the treatment that is keeping her alive at UCSF Children's Hospital is literally not approved for distribution in the country her family is from. That's the treatment that is keeping her alive. Weekly IV infusions. She doesn't get that treatment, she'll die. She's been told to get out of the country. The Trump administration is offering no appeals process. Her member of Congress, Democratic Congressman Mark DeSaulnier, her U.S. Senator Kamala Harris, have written to the Trump administration trying to advocate with the federal government on her behalf. But there's no process for them to do that. There is no appeal. There's just been this pronouncement from the Trump administration to Isabel and her family, get out and get out now. The Trump administration's plan, in other words, is to kill this young woman. She was, again, invited to the hospital for this clinical trial, which could not have happened without her. That clinical trial, because she was in it and because it worked, produced an FDA-approved treatment that not only saved her life, it will now save the lives of other people who have this rare genetic disease. Her family pays for her medical treatment with private medical insurance. Her family came to this country legally. She has never done an illegal thing in her life. But the Trump administration plan is apparently to kill her. One of her doctors joins us next.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.